I'm Dr. Eric Smith, and I'm working with the Alzheimer's Society of Calgary. I'm here today to answer some of the most common questions that people have about dementia. This video is made possible by the support of the Roman Catholic Diocese.
How can someone reduce their risk of developing dementia?
Many of the risk factors for dementia are known from epidemiological studies, and many of them are things that people can take action or modify in their own life that may potentially decrease their own personal risk. One of the strongest risk factors is having a stroke. So all of the things that can be done to prevent strokes and heart attacks also prevent the risk for dementia. That includes following up with a doctor regularly to have your blood pressure checked and treated if it's elevated, as well as to have cholesterol levels treated. Physical activity appears to be the most common modifiable risk factor for dementia and cognitive decline. It is recommended to get 30 minutes of physical activity, something that elevates your heart rate a little bit. That could include a brisk walk, swimming, or resistance training like lifting weights. Ideally 30 minutes, 5 times a week or more. There's an association between diet and risk for dementia. A more Mediterranean-style diet has been linked with lower risk. So that would include eating fruits and vegetables, ideally 5 servings a day, eating red meat in moderation, like once a week or less, getting protein from fish and cooking with olive oil. We don't know for sure that doing these things will modify your risk, but there is evidence that the risk for dementia for a given age has decreased by almost 40% over the last 4 decades. Unfortunately, even though people's personal risk is decreasing, our society is aging so rapidly that the total number of cases of dementia continues to rise. So it's important for everyone to take action for their own personal risk.
Can a person who has been diagnosed with dementia still benefit from doing things that encourage brain health?
Even though we don't have a cure for most forms of dementia, there are steps that everyone with dementia can take to improve their brain health that we think may slow the course of dementia. That includes staying engaged in interesting and engaging mental activities, getting physical activity, ideally a half-hour a day for 5 days a week or more, eating a healthy diet, including ideally 5 servings of fruits and vegetables a day, and having vascular risk factors like blood pressure checked and managed by a doctor. These things are good for everyone's brain health, and they're good for the brain health of people with dementia as well.